Well, good evening, everyone. Why don't we call the meeting to order at 7:33 p.m. The Town of Fairfield Board of Health meeting. Tonight, April 19th, 2021, again, 7:33. In attendance, we have, across my screen, we have Ms. Mitchell, Ms. Vitale, Mr. Cleary. I think Dr. Morose is there. And I think, I don't know who call-in user 2 is. Is that Ms. Flynn?
Yes, that's Andrea Flynn, so I can connect outside the conference
And
room.
Ms. Connolly is there as well. Do we have anyone else in the meeting that I've missed? Great, fantastic. Why don't we start with the approval of minutes? Hopefully everyone has had a chance to look at the minutes that were sent out earlier. I did not have any comments or edits or questions. Did anyone else have any comments, edits, or questions? If not, if I can get a motion to approve the minutes as written. All right, fantastic.
I approve. Is anyone else really choppy audio right now?
It may be you. Everyone sounds okay to me.
I'm good.
I'm good.
Okay, now it's fine.
Great.
Okay, thanks.
Ms. Vitale, seconded by Ms. Connolly. All those in favor? Say aye. Any opposed? All right, fantastic. Motion passes. Why don't we move on to the next item on the agenda? Director of Health report, Mr.
Sure.
Cleary.
So just in terms of some of the data going on right now in Fairfield, we just went over 5,000 cases, 5,041 cases, and just broke 200 deaths, 202 deaths. Our case rate, the 14-day case rate did increase last Thursday again, but promising news, it did only go up 0.2 cases per 100,000. So it indicative of a slowing of the increase that we had been seeing over the past 4 weeks. So we were, about a month ago, we were at 18 per 100,000, and now we're at 35.1, so nearly doubling. So still very, going in the wrong direction, but at least it's not jumping up. The last few weeks it's been jumping up, six, between 4.5 and 6 cases per week per 100K. So somewhat of a good trend, and that's also is reflected in what we're seeing in Connecticut in terms of some. It's not as clear, but some signs of leveling of cases being seen in Connecticut as well, and some signs in the U.S. as well as a leveling of cases. So it's not increasing quite as it has been the past several weeks. So some hopeful news. It's not necessarily reflected in the dramatic increase. We're not feeling that yet in relation to contact tracing, which is still keeping the staff very busy. We're actually bringing on 3 additional part-time staff to assist with additional contact tracing activity, because that has just gone through the roof for us and most other health departments that are contact tracing as extensively as we are, especially in relation to the schools. In terms of vaccinations, we are making good progress in Fairfield. About 96% of those 65 or older have had their first vaccination, which is a pretty good number. Most everybody else, the state is at 88%. US is about 80% of those 65 and older. So we're a good portion higher. We've got about 83% of our 45 to 64-year-olds had their first dose. and 37% of our 16 to 44-year-olds are have had at least a first dose. We in Fairfield are up to 19,575 vaccinations given. We did 1,391 last week. And well, of note, this past month, while it's it's challenging every week, on 4/1 we had our second dose clinic for our education and child care folks from the 3/1 clinic that we had. We ended up doing 1,576 vaccinations in one day in the period. So it was very challenging. It did kind of, I won't say overwhelm the system, but it definitely challenged the system. You know, we had some fairly long lines, longer than we've experienced. So we kind of learned, and we have been pushing it each week, and so this week that week we kind of learned, well, that's, you know, even with 14 vaccination stations, we couldn't catch up and get ahead of it. But it was pushed it. We tried it. We were able to get through it and get most of the education and childcare staff done. So talking about some of the big things that are happening now in terms of sector rules updates. Today, the governor announced that May 1st, they are going to increase the hours for restaurants to midnight. Had been 10 p.m., then it was 11. Now they're going to do that to midnight. They're going to lift the outdoor restrictions for outside. Like, so if you have a bar area outside, you can have a drink outside without having to order food. And May 1st, they're also eliminating the table size limit. So there's no limits on size of the crowd in a restaurant. Still have to try to do the social distancing and masks inside. And then May 19th, all remaining business restrictions are ending. So there'll be no further restrictions on business. There will be recommendations coming out in terms of safe operation of indoor and outdoor events. And it's likely that masking will continue to be either a requirement or a strong recommendation. So that is a fairly significant change in terms of basically there's no more sector rules for enforcement. And so that's was sort of the big change today. One of the things we're also seeing the first indications of, and this was actually reflected in the governor's conference call today, but for example, we're starting to see some indications of supply exceeding demand in terms of vaccination. Posted our clinic for this Wednesday, last Friday morning, posted 500 spots, and as of today, there are still only about 200 people signed up, and so that's a first for us. Even 2 weeks ago when we did our Johnson & Johnson clinic, we had 700 doses, and it posted it on a Monday at 12:01. Monday by 12:22, all 700 spots were taken. So it's quite a change in 2 weeks to see spots, hundreds and hundreds of spots going in minutes, and now hundreds of spots not filling up and being left empty at this point. So I did email a couple of the other health directors in the area, and they said they're starting to see the same kind of indications that basically a lot of people have already found appointments and they're either sticking with them, and even the folks that we have clinics scheduled out into May, and we sent notice to them, the first dose folks, and said, hey, we've got spaces at our clinics, this week if you want to sign up and up a little bit, and the numbers didn't change at all. So people are finding vaccination spots. I think there's so many of them available now. Most of the pharmacies have it, and this is reflected in comments by the governor today that certain spots of Connecticut they're starting to see slack in clinic schedules, and so So it's it's a good sign that we're at that point where we have plenty of vaccine, that anybody who wants it can get an appointment relatively quickly. So it's been a long time coming for that. So we're happy to see that here. And so the next big challenge for us will be when they lower the age range down to 12, we'll have to switch over to probably initially switch over to Pfizer and start delivering that. But that's what we're ready for that, but we'll probably end up scaling back for a time, going down to probably just one. We'll just gauge that upon demand. So the other, regarding our budget, we are moving forward with the budget presented to the Board of Finance, and the Board of Finance approved our proposed budget with no cuts, and presented it to the RTM. And so we're still waiting for a vote on that. That'll come in. We were notified that we will be the recipient of another round of funding, the epidemiology and laboratory capacity 2 grant will be coming out, and so we should get. They indicated somewhat in the same range as what we received for year 1 of our ELC1 grant, which was a little over $100,000. So that'll help us with a variety of tasks and some additional staffing potentially. Still waiting to see what guidance they put out in terms of what the monies cover. But as we get that, we'll plan appropriately. And then just as I said before, and Jill can speak to this a little bit more than I in her report in terms of, just the contact tracing continues to be significant pressure on the town, just in terms of just relations to the schools. It's every night it's a challenge, every weekend it's a challenge. So we're working to bring on some additional staff to assist with that. But that's one of our big challenges. And then in addition, one of the activities that we're working on is the insurance submittals for vaccination, which is, somewhat of a challenge as well. They informed us this past week that, for those who are uninsured, and we have a lot of people who didn't provide any insurance. And so we're working through those who provided us their insurance cards, and we've already been submitting those through our insurance portal and have received, significant reimbursements already. But the state has entered a contract with United Healthcare to do the uninsured. And what it requires, or what they request of us, is that we call the people that are uninsured to make sure they're uninsured, and then obtain from them their driver's license and or social security number, which will be a very challenging tasks to do, especially since there's been multiple messaging coming from the governor's office down saying, don't avoid the scams. Nobody will ever ask you for your social security number or any personal information. What you provided in VAMs to get vaccinated was sufficient. And so it's a little in conflict with that. So we're trying to work through how that will actually work. It simply isn't a feasible solution to have to obtain that information from those vaccinated, but we will keep working through that. But it's we actually have brought on 2 additional part-time staff that are solely focused on doing insurance entries at this point. So we'll continue to then bring on an additional person just to focus on calling those who misentered their information, who didn't enter it, who provided their, they actually have Medicare, but they provided their one of their other insurance, like a Medicare plan, I forget what they're called, a managed care organization plan that manages your Medicare account. So, but for those, they're saying those companies have rejected those claims and saying, no, you have to submit those through Medicare. Everything else goes through us, but just for the COVID shot. So we're working through that. So just a variety of different challenges for us continues, but we'll keep plugging away. Forward to hopefully being able to, at some point within the next few weeks, start to vaccinate some of the younger. I'll wrap it up at that. Short turnaround. Bill and I were actually away this past week, so a little less activity in the office for us.
All right, great. Thank you. Are there any questions for Sands? Yes, Christine.
Hi, Sands. Thank you for everything that you've been doing, as always. Just in terms of vaccinating the students, younger population, how easy is it to get the Pfizer vaccine and to set up a clinic for students?
So, and we've actually requested the state, if we could have, we've already done that, requested to get Pfizer vaccine for go down to the 16-year-olds, and the state rejected our request and said that for now, the state is focusing on alliance districts, that those are the only ones that will be getting the Pfizer vaccine, and that towns like Fairfield probably couldn't expect any until mid-May. Now, that may change with the supply starting to exceed demand. Things are moving pretty rapidly to be, 3 weeks into, less than 3 weeks into everybody being able to get it. We're already starting to see saturation of the current age groups. So that may change a little quicker, since people were saying that they didn't expect this to happen for another 2 weeks or so, till we started seeing some slack in schedule. So it may bump up, but yeah, we've already put the request in. We rejected. We've already laid out plans to do it. It's just a matter of when will the state give us the vaccine.
Is there any? Sorry, Henry.
Oh, no, I'm sorry. I was just to follow up on that. But in order to do the Pfizer vaccine, we're going to have to partner with another entity that's able to store it, correct?
No, so Pfizer can go 7 days at refrigeration temperatures, and we can do the 1175 in 7 days. So we can do it. It's some of the smaller health departments just aren't doing the volume we're doing.
Gotcha.
So, so as soon as we can get it, we plan to do it.
Is there anything that we can do to help in terms of advocacy at the state level, you think? I thought that I had heard some other school districts were able to offer the vaccine to their seniors, and I don't think it was an alliance district. I guess I could reach out to them to see if
So we've offered some to seniors who are 18. So we've done a number of high school seniors, and we reached out specifically over the weekend when they were eligible to get them in. But I think what's happening is some, they tend to be a rule follower, and so if the state says no, then I'm not gonna go around and do an end around, which I think is essentially how some of these other entities are doing it. They're partnering with a hospital, and a hospital is a private entity that, private for a profit entity, and they can go ahead and do what they want to some extent, and not really fear the repercussions. For us, they've kind of told us, yeah, they've already somewhat scolded us, for in the past, and we paid the price for a couple of weeks with not getting vaccine supply adequate to cover our they required us to stop scheduling first doses for a time because essentially we were using whatever vaccine we had and on hand and to vaccinate people, whether it was first dose or second dose, and it was messing up with their systems. And so they kind of reprimanded us a little bit, not in a, they're very happy with us because we do more than most. But, they had to sort of curb us while there is shortages. Now there's plenty, and even, they quadrupled our minimum request when we were eligible to get more. We asked for more, and they gave us 4 times the amount that they were giving us before. So, you know, so I don't think they're like upset with us, but you know, so I don't know what price the hospitals will pay for. You know, I heard the same thing of some, you know, some places were doing it, and I don't know exactly which schools are alliance districts, so I somewhat assumed that was their in, but I know of some of the others that aren't, and they are just, you know, sort of doing whatever they have to do to try and do it regardless of the rules.
Thank you for that clarification. That's all.
So Santa, just along those lines, and I'm not exactly sure, but so I will tell you that in Stamford, Stamford is an alliance district, but my understanding with the state and focusing in on those districts was sort of a separate set of potential allocations, and then working with school-based health systems and other things. Christine, I know that one of the community federally qualified health centers all over the state offered vaccines to anyone 16 and over because they have Pfizer available to them. So since 16 and over is available, any 16 or 17-year-old can find Pfizer vaccine at any, you know, vaccination site. What I think is a little different is I don't think any of them are doing targeted schools. Well, and at least I know in, you know, in Lower Fairfield County, we're not targeting schools at this point in time, but I think that's the goal. At some point in time, some of the alliance districts schools may be getting some help to do it in with either school-based health centers or other specific clinics. So hopefully that will get geared up for everyone before the fall, right? Because that would be great if we can get all the kids vaccinated before school. It would certainly make a difference in terms of quarantining, and it would make Jill's life a whole lot better, you know, once we're able to do that. So thanks, Hans. Any other questions for Sans? All right, fantastic. Jill, you're up.
Thanks, Henry. Let's see. Actually, I do want to talk a little bit about the whole quarantining process and how it has changed since the elementary schools and the middle schools have been back. As I'm sure you all know, they've been back March 8th and March 9th, full-time, 100% in person, and it has had really significant implications for quarantining and contact tracing in the schools. It is by far the biggest challenge that the school nurses and our department down at PHN with the contact traces are facing. Before I want to get started though, and I really don't think I've ever mentioned this before, I really need to thank the FPS staff, from teachers, principals, administrative staff, for all of their help, assistance, efforts, whatever they can give us in this contact tracing effort. We just would not, really and truly would not be able to do it. As a matter of fact, before break, you know, everyone deserves a vacation, and we weren't going to have access to school staff to help us with that. But the IT staff really stepped up to the plate. For some schools did it another way, but somebody from IT, Amy Germano, I'll mention her name, she was able to upload seating charts for a few of the schools, notably Ward High School. And when we got reports of positive cases, particularly earlier in the week when we would have needed to do contact tracing for the previous week, we were able to look at seating charts and kind of extrapolate from that, you know, the 6-foot distancing and what children needed to be quarantined. So we continued with that. You know, I personally didn't. I was taking a break, absolutely. And but the rest of the staff did it, and I think it worked out really well. But I really did want to thank FPS for their cooperation in that. I will say that the CDC and the state DPH, they have not modified their definition of a close contact. We have been told that time and again. We have asked time and again, and It's really just not going to happen. It remains exposure at less than 6 feet for a cumulative 15 minutes over a 24-hour period. And that is despite having the CDC say that, 3-foot distancing in the school setting is safe for our students. As I've mentioned before, the number of students who need to quarantine when exposed to a positive case has increased significantly on a per case basis because of that resultant increased in-person density. So to manage this, I mean, we're doing contact tracing 7 days a week, morning, noon, and well into the night. To manage it, we really make absolutely every effort to call those who need to quarantine, call the families of those who need to quarantine. However, we have used email blasts with detailed quarantining information that we send out. And when we can't do it, I mean, we get a late night report. I mean, one Sunday, a couple of Sundays ago, it was just one report after another, and we ended up closing 3 schools the next day. When we just can't get it done, that's our option. We had multiple cases at different schools, and we just didn't have the resources. I don't think anyone has the resources at 8:30 on a Sunday night to make those kinds of calls. So we did. We closed at least one school 2 days, and I think 2 other schools 1 day. Closing schools for me it's personally very disappointing, as I'm sure it is for staff, for families, for parents, and for students. The email blast has been working well when we give our detailed quarantine instructions, and I believe that most parents now are attuned to reading their emails for such notifications at whatever hour. I have to tell you, just as I was sitting here, I got an email ding, and I'm like, oh gosh, who knows what's going to be there? Hopefully it's just some notice from the CDC, but I'm afraid it might be a report. Let me see where I am. So the email blast, I think, is working well. Parents are reading it. We generally like to follow up with phone calls the next morning. And certainly in the quarantine notification, we give the number of my office as well as the number of the specific school nursing office for any questions about quarantining or testing, whatever they need to do about other members in the house. Some of the principals have done cover letters for, the attachment that we have, and, they've been great. They've been just great, detailed, how do you get into the remote learning the very next day, who you need to contact, what do they need to do as far as their schooling is concerned, and, is quarantining going to go against their absent, just all sorts of information. So it's been a really good partnership as far as that's concerned. Now, having said that, and I just really want to say quarantining is really important. It works. We have had approximately 8 cases of in-school transmission since the beginning of March. And since we were able to quarantine those students, they were home. They weren't able to transfer it to anyone else. And so it does work. Those 8 cases did not have a spread to other students. So it's important work that we're doing. We do the best effort that we can. I cannot say that it's perfect. And we always get phone calls. My daughter says she was close to the next day, and that's fine. We'll, take those calls and interview them. And if we make the decision to quarantine, just give the information and go forward. Having said that, I'd like to review some of the positive numbers and the numbers of the positive cases and the trends that we've seen and hope to continue to see going forward. So over the last week of March and the first weeks of April, we had a number of days in which the daily cases reported, and I'm not talking about new cases every day, but the daily report of case averaged about 46 cases in the schools. And you can get all this information from the dashboard on FPS. One day we had a high of 74. I mean, these are high numbers. We can compare this to January, and everybody was talking about the post-holiday increase, and we were averaging about 31 cases over approximately the same time frame. These few weeks have been unusual, and they has, as Sans mentioned, generally reflected the other health metrics that we're seeing in the county and the state. With this week, it's kind of leveling out, but certainly they have been increasing in the prior weeks to that. And that just happened to be when, we went back to school full time. I will say it's really nice to see that there's only been one positive case among staff in the past 10 days. And that's undoubtedly due to, the vaccination efforts and the commitment that they have to getting vaccinated. So I'm pleased with that. Now, comparing the different levels of schools, the rate of positive cases among high school students is about twice the rate in the elementary schools. Some of this has been attributed to socializing. Some of it has certainly been attributed to after sports activities and socializing associated with that. And, general just increased interaction among peers in that age group. If you look at the elementary schools and the sources of exposure, it generally is another family member. As we get into the high school, it could be, the sports contact, or I was at a party on Saturday night. And so there are different reasons for exposure and different types of exposure and subsequent infection. But the pandemic's not over yet, and we really need to be mindful of all the precautions that we have to take. I just want to say we're not done with it yet. I can't wait to, 2 months ago I was saying, I can't wait to vaccinate the teachers, and now my mantra is, I can't wait to vaccinate the children. And hopefully parents agree with that. That's all I have to say about that. As far as my office is concerned, we were thankfully able to not increase our staffing, but at least fill some positions. Actually, we filled them, at least in one case, with one of the nurse volunteers at the clinic. She just loved working with our department, and now she's working in the schools as well. So I'm really happy with that. And, we still have openings, and I'm interviewing more and more people, more nurses this week, and hopefully we'll get those positions filled soon. And that's it for me.
Great. Thanks, Jill. Anyone have any questions for Jill?
Well, I was just going to say, Jill, with the, it's about 12,000 students in town. I think we can probably vaccinate them all in one day.
Hold on.
It's a little joke.
My volume is down. Sans, what did you say?
I said, it's only 12,000 students, Jill. We could probably do it in one.
Please, someone stop them.
Do a vaccination marathon,
Yeah. Well, you do have 24 hours in the day, right? So.
Oh, yeah, sure. I'm up. Why not,
Well, it
I'm
is.
going to
go ahead.
interject. Okay. First of all, thank you, Jill. I don't have a question right now. I figured I'd give my little anecdotal story just so people have it, which is that, so 2 weeks ago today, our entire family got tested prior to, we were supposed to go away on the trip that we were going to do last year. And because we got PCR tested Wednesday morning, we found out that one of the 6 of us actually was positive, my 14-year-old. And so I had to cancel the trip same day, which is really thrilling. And I was sad, but now I'm laughing because that's just how life works sometimes. And I was actually grateful that we did that PCR test because there weren't really symptoms. So I kind of want this to be on the record, just for people to know that the first symptom was actually just a complaint of a sore stomach. So, and it was Easter the day before, so I thought it was from candy and chocolate. But also just to make the commentary that child had not done anything different. So I could definitely see how this could be more related to possibly, transmission and the variants and just easier transmission, basically. Hold on, I'm just talking now. So anyway, on that note, we ended up, hold on one second. Okay, so on that note, then what happened after that was just the trickle down, because of course everybody had been together, all the kids. Then my 16-year-old tested positive like a few days after, then my 10-year-old, and then my 12-year-old the next week. And we did do some separating with the 12-year-old, but of course from the very first day, couple days, they had all been together before us knowing that anyone was positive. We were also a good test because I had been fully vaccinated since February, and my husband actually was one vaccine in. He actually got his second one just yesterday. So I did not get anything. However, I didn't either when I wasn't vaccinated, but I'm assuming that was helpful. And then he did not get sick. So it was kind of an interesting little experiment, I guess. And overall, all of the kids, the 10-year-old, I only had him tested because he had a very slight stuffy nose. I thought the two youngest were going to escape unscathed. And when it came back positive, he yelled, "I don't have COVID, it's just a cold." So just to kind of point out how for my kids, none of them had a fever. A couple of them had a little bit of chills, but no fever, no real respiratory issues. So I just think it's really interesting, and I think it's important for people to remember the variety of the symptoms, and that you don't necessarily think, oh, my stomach is a little bit sore, and have it go right to that's COVID, right? I mean, we also saw the sore throat later on, and a little bit of evolution to a stuffy nose, but it just wasn't what I would have expected based on everything I had experienced and read, right? Just to see it happen. Anyway, I just thought it would be maybe helpful to get a little bit of an inside scoop. And on the positive, it was mild for all of my kids for the most part. Coleman, the 16-year-old, was the least comfortable, but he did go back to school today because it was well over the 10 days, and but was fatigued. So anyway, that's a little story there. I just wanted to share it. So I appreciate your contact tracing. We tried to make it as easy as possible, right, Jill?
Oh yeah. And Sally,
Fortunately, Coleman has a photograph.
it broke my heart that you had to cancel your vacation. I was so upset about that, but I'm glad the
It's okay.
all mild.
Well, and I was glad if we had actually been going to a different place, we wouldn't have had to get PCR tested. And it actually was certainly a wise thing to do. It just was bad timing, but I got my money back. So,
Oh, good.
and nobody else got sick. So,
Next year.
Right.
all right, that's my story. Thank you for the work you're doing, Jill, and everyone.
Sally. Thank you.
Right. And Sally, so just to add insult to injury, not only was your vacation canceled, but you got to go to work because you didn't have to quarantine because you were vaccinated. You're vaccinated, right? So
right. But the good news is that my work is flexible, so I didn't waste my PTO time.
right.
And yeah.
Yes, yes, that's I guess that's a double-edged sword. I was a close contact and I called work and I said, I'll be back in 14 days. They're like, no, you're vaccinated. I'm like, so
Right.
anyway, something to look forward to. Thanks, Jill. And if no one else has any other questions for Jill, we'll move on. Sans, any communications?
I have none.
I don't have any either. Old business. Does anyone have any old business they'd like to discuss? All right. Any new business? All right. Fantastic. So if there's not anything else or any other comments, can I get a motion to adjourn? All right. Christine, thank you. Seconded by Sally. We will adjourn their meeting at 8:13 p.m. Thank you, everyone.
Thank you, everybody.
Okay. Have a good evening.
You too. Have a good night.
Good night, everyone.
Bye. Bye. Sally, I'm glad everyone's
Good night.
feeling better. Thanks, Jill. Thanks, Sands.
Thank you. Bye bye.